Good evening and welcome to this presentation on understanding and managing anxiety and depression. I'm Kevin Marsh with KSB Hospital. This year, our community wellness focus is on improving brain health. This program was originally scheduled to be delivered to a live audience on this very day. But because of the COVID virus, live doesn't work right now. But we still feel that the topic is important and timely. And as such, our presenters agreed to provide you a virtual version. Joining me today are Melissa Gates, who is a psychotherapist and licensed clinical social worker, and Dr. Samir Jain, a family medicine physician with the KSB Medical Group. Melissa and Dr. Jain are here today to share with you some of the mental health impacts of the current COVID situation, along with helpful tools that you can use to better cope with this truly unique situation. During the initial broadcast of this panel discussion on May 12th, the panelists will be available to answer as many written questions as possible submitted during the Facebook app until 8 o'clock. And now, on to our program.
Good evening. My name is Dr. Samir Jain. I work with KSB as a family doc. As many initiatives that KSB does, we are doing and focusing on brain health this year. The stigma which has been attached with mental health for a long time has limited the ability of patients as well as even employees to look for help. Depression and anxiety being the most common of these mental health disorders. Thanks to our current generation, they are more than willing to talk about it. Every emotion elicits either anxiety or depression for them, although that's not clinically the criteria which we use to diagnose for depression and anxiety. And at the same time, there would be times when people would just not even recognize that they have it, and they live their life as if it was a norm to go with that. With COVID-19 here, it has raised so many new emotions. People are so scared, afraid. They are feeling financially unstable. So many different emotions have been elicited. So that has also increased the ongoing anxiety for some people, and some people are getting new onset of anxiety and leading to depression. So today, I would like to welcome Melissa Gates, who works with Path to Healing, and we'll talk a little bit about COVID-19 and how it is causing anxiety and depression.
Thank you, Dr. Jain. Yeah, my name is Melissa Gates, and I'm a licensed clinical social worker. I own Path to Healing here in Dixon, Illinois. I have another therapist that practices with me. We do psychotherapy for a wide range of behavioral health issues. We provide services to children, adolescents, and adults. And we also provide divorce and co-parenting mediation services. As this is kind of a pre-recorded session for you and I can't really give updated numbers for COVID here in Lee County, but there are a multitude of areas where you can go on Facebook or the web to be able to get updated information here. So you can go to, obviously, the KSB website. You can go to the Lee County Health Department. You can go to the City of Dixon government Facebook page. And you can go to the Lee County Emergency Management Facebook page. For you, Dr. Jain, can you kind of give us an idea, like a brief overview of COVID-19 maybe?
Definitely, Melissa. COVID-19 is a new kind of virus which we are getting to know more and more every day. The information changes on pretty frequent basis. For somebody who doesn't know a whole lot about it, it can be very fatal to people who already have pre-existing conditions. When we talk about pre-existing conditions, we are hinting more towards people who already have established lung disease, heart disease, diabetes. That can actually cause more intense reaction to the virus from our immune system. The most common symptoms are very similar to what we would get for somebody with flu, like having fever, shortness of breath, cough. And if somebody has all three symptoms, at this point, we are recommending that we get tested for COVID-19 at that time. Then there are certain other criteria, I wouldn't say criteria, but symptoms which have been noticed, which could be coming from COVID-19 as well, like fatigue, body aches, diarrhea, nausea. But as I'm saying this, you would realize that these are such common symptoms that sometimes we can't really distinguish whether they are coming from COVID-19 or they're coming from some other disease which we already have been dealing with in the past. But with current pandemic situation, it's very important that we screen these patients for COVID-19 and we look out for these symptoms for their well-being and the well-being of the society.
Mm-hmm. Where would be some of the places where they could go to get treatment for COVID-19?
Most times, the disease, as we have noticed so far, like you know, 1/3 of the patients who were infected throughout the world have already recovered from it. Self-isolation, quarantine, staying home, keeping up with your fluids, watching for any worsening of the symptoms, that is something which you and me can do at home.
Mm-hmm.
Obviously, if you're having increased shortness of breath, if the fever is not under control, and you feel that the symptoms are deteriorating, at that time we should be looking for help from the hospitals.
So are you seeing, I'll talk about my practice in a few minutes, but are you seeing any increase in brain health issues or behavioral health issues in your practice because of COVID?
Like any other disease, we do see some brain health issues when it comes to coping with any new disease. We had the similar kind of issues when we first having heart attacks and diabetes, and now people have got used to it. They still would face anxiety and depression or other just stress, as they normally call it, and it does periodically affect them. But I've definitely seen a significant increase in the patients looking for care for stress. And it's hard to say at that time when they come to my office whether it's just stress or it is an underlying anxiety, depression, or some other brain health issue that is getting worse because of the current situations. So yes, there have been cases where people have lost a job, they don't know how to survive, or they have a family member who is sick and they can't really communicate with them, or somebody is hospitalized but they can't go to the hospital. So a lot of emotional turmoil is being noticed at this point, and that definitely will, I'm assuming you'll agree with that, increase the possibility of getting anxiety and depression now and in future as well.
Right. In my practice, our numbers really dropped off the beginning of March, but we're really starting to see kind of an upswing in people seeking services now. I think anytime there's that kind of disruption in your life and that kind of fear, that uncertainty, people kind of go into that survival mode and they go into the fight, flight, or freeze scenario. Any kind of disorganization and confusion can even make people shut down initially when it happens. And it's a really normal reaction for people and for children to do that. A majority of our clients, like I said, started to come back in and seek services somewhere around the middle of April when the shock of everything kind of wore off. And they started to realize that they could continue to seek services and go out in a limited way to get essential resources for themselves. But anytime somebody's safety and security is challenged in the way that COVID's challenged us, people go through an awful lot of stress, and it can manifest itself in lots of different ways. I mean, we literally went from seeing people face to face every day for hours at a time, both of us did, to, I don't know about your practice, but we went down to maybe 5 or 10 patients a week. So it really kind of put people into that survival mode, and obviously we're all doing sheltering in place, but they were really afraid. So some of the terms I think that we probably should acknowledge that people went, it was like March, I can't remember what the date was, mid-March, but we went from normal activity to shelter in place, and everybody had to scramble to figure out how to cope with that. We all became very familiar with terms like quarantine and working from home and shelter in place and e-learning and social distancing and essential and non-essential workers and face masks and gloves and where's the sanitizer, and all of those terms were new for all of us. So it's taken a long time, several weeks now for all of us to kind of become accustomed to those terminologies and what they mean to us in our normal life.
Like you said, all these measures, although they are needed for the safety, they definitely elicit more anxiety and depression. And people who already are suffering with these disorders, it probably makes their symptoms worse.
Mm-hmm. Yeah, there are many individuals who are already suffering from a whole range of mild to severe anxiety and depression. Some of the people are have a predisposition genetically to anxiety or depression or a variety of other behavioral health issues, but a lot of what we're seeing them come in right now is situational anxiety and situational depression. So more of an adjustment type disorder. But there are a lot of people who already were in treatment, for example, and it's really exacerbating all of their symptoms at this time. We all experience things in our own ways, so some people have a greater capacity for coping with situations that challenge their security and their safety. And some people really have a difficult time when there's a disruption or a change in their routine. So the isolation, the change of routine, the fear of getting sick, not having access to normal resources, the economic changes, the fear that goes along with, can I provide or not provide? Can I get food? Can I not get food? All of that contributes to an increase in adjustment issues and anxiety and OCD type issues, depressive issues, all of those things we experience normally, but it is on an increase right now because of COVID.
It has been an adjustment for us as well, having kids at home full time, and then after working full time and then going back and dealing with that has not been easy, where my kids didn't want to go to school or to daycare, and now suddenly they're asking, when can I go back?
Mm-hmm.
It's just an adjustment for them as well. Same thing happened at work as well, because here we had never done telehealth, and suddenly we're thrown in a situation where we know patients need our help, they need the care they deserve, and we unfortunately, because of the current circumstances, can't do that in person.
Mm-hmm.
So learning a new software and then implementing it and on a very short notice, and then it has been a very good learning experience, how to do things on the fly.
Mm-hmm.
But then I've learned now that, go with the flow. There is just sometimes we can't control everything.
Right. We experienced the same thing in our practice. We went from face-to-face services to our clients to scrambling to find some type of telehealth platform that we could meet their needs. And we actually have quite a few patients who they can't make that transition because of the issues that they're dealing with. So we were in a place where we had to make a decision, each of the therapists, about their comfort level and their family situations. And Shannon Dean's the other therapist in my practice, and she's gone completely to telehealth. I've stayed doing some face-to-face, but obviously we've had to change all of our protocol in the office to be able to make it safe for people to come in at different times. And at home, everyone in my house is still working. None of us have really, other than that first week or so, have been sheltering in place consistently like others might be doing, because we all have what are deemed essential jobs. Even my daughter is still going to work at Culver's. And I think for everybody, we kind of have this ebb and flow of sometimes we're okay and sometimes we're not okay. And I think that's okay for everybody. It's okay to not be okay sometimes. My daughter is, like most teenagers right now, I think, like you said, they were really happy to be out of school, but then they realized what e-learning was and how much time that takes, and they have to be self-monitoring and self-motivated in a lot of ways. A lot of parents had to learn to be teachers all of a sudden, and they weren't ready for that. But I have to say there's a lot of positives to it too. At my house, I'm very thankful for my daughter and her sleep habits, even though she stays up until 1 or 2 in the morning and wakes the dogs up, and then they wake us up, but she's getting her homework done, she's doing her e-learning, she's talking to her friends on Skype and on Zoom and playing video games with them online, and she's cleaned out all of my cupboards in the kitchen, and she's cleaned out all of my closets. So I'm really not going to complain about her new sleep habits.
I think that's a good thing. As humans, we are somewhat trained to look at the glass half empty most times, and the fear rules the way we make several of our decisions. But looking on the positive side of a situation we have no control over probably should help a little bit with the stress we experience because of the new situation. And then on top of it, it's very important to keep that normalcy going as well. Waking up on time, getting dressed up, taking care of things which you need to, which you would do if COVID-19 was not changing our life, like it has already done. Going to bed on time, introducing some exercise if you're not doing that, and that's a normal thing which we would say anyways. So
Right.
I think it's important to have that routine going along. So when the situation is done, we are not for another shock when we have to go back to how life used to be prior to this.
Right. Yeah, I think the routine is really important. It does give us normalcy, and I think on the flip side of that, it's also really important to be flexible during your day, especially with your children, but with yourself as well, and anyone else that you're isolating with, that you're doing shelter in place with. It's important to give yourself a little grace and understand that you're going to ride these waves of 1 minute you're doing fine and you think you've got this licked and you really have control over everything, and the next minute you're in a pool of tears crying because you're so overwhelmed, and this child won't sit at the table and finish their homework, and that one wants to go outside and play with their friends, and they can't see their friends right now. And it's okay to ride that wave and to give yourself some leeway to not be okay once in a while.
And like you're saying, it's really okay to feel the emotions because that's where we have them. I normally just would take a good deep breath, close my eyes, and then say, okay, let's go for another moment and see how that comes along. I've even started doing a little bit more exercise. I'll go out, take the kids out for a walk, go for a run. It takes that negative energy out of you, and then suddenly you feel more rejuvenated and you would like to go back to your old worries, which you could forget for a few seconds or a few minutes or an hour a day. So I think that's a very good practice right now if you want to just take your dog out for a walk, take your kids out, play with them, throw some hoops with your kids, and there are so many good things happening, looking at the humor of the problems. I would like to show you my mask. I am a Batman right now.
I saw you come in with the Batman.
And it's just something, sometimes we have to look at the humor part of it too. If you go to any social media website right now, you'll find jokes, and people are just, I can't believe how humorous people can be at times. But then humor is also a coping mechanism.
Right.
And I think it's a good coping mechanism. Why not utilize it even more often? And hats off to all these moms who are doing full-time jobs and taking care of the kids and the family from home right now. I do not think I can ever do that. So, I definitely see their pain now when we have to go through this ourselves. But again, it's important to keep all these safety precautions going. We need to keep the social distancing. We need to wear a mask in the public because we're trying to cut down on the treatment. We're trying to cut down on the spread of this virus, which could be very fatal if we don't do that. And as a community, we have a responsibility towards ourselves and as well as our elders and our neighbors and friends and family. So I would say we need to have these safety things right in place. And I think it's very important to connect with people as well. We're lucky that our technology has advanced so much. I don't think we would have been able to do this 20 years ago. Now FaceTime, Skypes, I'm not sure, Snapchats, there are different options out there we can utilize and connect with your friends, with your family. You can have virtual dance parties, birthday parties. So there's several other things which you can actually be doing at this point, even though, humans do need the touch, and we're missing that right now, but we're going to get to it soon.
Yes. Yeah, and I think it's really important to remember our children are also going through a lot of the same issues that we're going through, and they can show a lot of their own types of anxiety and depression as well. They're feeling the isolation, they're feeling the change in their routines. The children depend so much on school to give them not just the academic outlet, but the social emotional outlet too. And they really need that developmentally and emotionally to help with their brain health, with their emotional stability. So now with their parents doing it for them 24/7, it's really important to remember that your children are going to have bad days, and they need a little patience, and we need to be able to talk to them developmentally appropriate ways to help them learn different coping skills. E-learning is really important. I'm very worried that we're losing a lot at this point, but they're going to be okay, and it's okay to give them breaks. It's okay. Go take a nap with your kids. Go outside with them. Let them play, like you said earlier. But remember that they're going to need to kind of develop their own coping skills through this. And I think there's lots of different activities you can do in order to help maintain or to decrease the anxiety. There's a lot of deep breathing exercises you can do. There's a lot of sensory exercises you can do to try to be mindful and to kind of bring your nervous system and your brain and make it more organized. You can search the web. There's tons of them out there. I won't spend a lot of time going into them, but I do want to talk about things that we should really be looking for when it comes to behavioral health, whether it's ourselves or our children, that if it gets too big, if it gets too overwhelming, and a lot of the things that I'm going to talk about are normal, everyday responses to a pandemic type situation that we're in. But I'm talking about when it goes beyond kind of an adjustment, when it becomes overwhelming, when we're preoccupied with it all day, and it really starts to interfere with our functioning. So we really have to be careful about when we're not sleeping, when we're having insomnia too many days in a row, or if we're sleeping constantly and there's a lot of fatigue and we can't get our daily activities done. A lot of excessive worrying or racing thoughts that you just can't stop, panic attacks, feeling overwhelming fear that doesn't dissipate and doesn't go with that ebb and flow that I talked about earlier. An increase in kind of obsessive compulsive type behaviors, increase in anger, not being able to get out of bed or to leave the house when it's appropriate to leave the house, right? Hoarding behavior, excessive crying spells. For children, sometimes we see them being extra clingy or needing constant reassurance. They start talking about a lot of the things they see on the news that scare them. And some of them have regressive behavior. So it's really important as parents to pay attention to those things. And that's really when those behaviors get too big, when they become a functional problem, that's when you really want to start reaching out to a licensed clinical professional, or you want to call your primary health physician, because those people are going to be able to help you, guide you to services that are appropriate for adults or children.
Like Melissa has been saying, it's very important for you to recognize the signs first.
Mm-hmm.
And then once you recognize the signs, then you can reach out by starting with your primary care physician.
Mm-hmm.
There are different things which we can do. We can consider doing medications and what we call as cognitive behavioral therapy, and
Mm-hmm.
Melissa is an expert there. And we can also look into getting you hooked up to the regular resources. So if there is some social issues which you may be dealing with, we can help with that as well.
Mm-hmm.
And then medications, when we talk about, it's a common misconception that, an antidepressant is used only for depression, but it's actually very, very effective for controlling anxiety as well. So going back to the stigma which has been attached to mental health for a long time, it has been limiting our ability to look for help. Please look for help.
Mm-hmm. I guess, kind of in closing, I want people to remember we really need to practice some self-compassion and some compassion and understanding for the people around us, understanding that we're all going through this in a different way, and some days are going to be harder than others, but it's going to get better. We're going to start adapting as we get through this, and we will start to come out of that shock and that survival mode. So it's really important to look for the positives in life, to really try to understand that adversity is going to come at us anytime, whether we're in the middle of a pandemic or not. Adversity is going to come. It's how we handle that and how we process through that that really lends itself to the resiliency that our brains all have. Our brains are constantly forming new neural pathways, and your brain's going to do what you tell it to do, but you have to give it a chance to do that. And sometimes you have to make it very purposeful.
Definitely, and you might have some passions, right? Which, as we got older, we decided, I don't have time to do this. I definitely had that. I used to sketch. I bought a sketchbook and pencils 10 years ago, never got to them. Finally, they're out of the dusted closet, so I can use them now. It gives you pleasure. It gives you a sense of some kind of achievement. It gives you an ability to connect with yourself. And those are some of the positives which we can take when we have less social pressures right now to deal with. Going out, like as simple as joining an online fitness club. There's so many fitness clubs like now where you can do it from your home without any need for your instruments. Do some home projects. My kids have been making so many different kind of new activities they're doing and making things that it's just amazing how creative we can be when we let us be creative.
If you're given the choice, we really need to try and focus on the good and the opportunities that we're having right now, and see the positives in your day-to-day lives. Try not to focus on all the negative all the time. Put away your media. Don't be on the television all the time. Limit when you have to deal with the challenges right now, and really try to stay focused on the positive.
We will be available for a period of time to answer any questions if you have now. Also, if you need in-depth evaluation or need to talk to us, please reach out at KSB or Path to Healing. And please, we're here with you.